prior to inserting an IV, you want to make sure that you have a physician's order, an LIP order, and that you also are identifying the patient. So I've come into the room, I've done hand hygiene, I would look at the patient's bracelet and compare it to the order set. Now I'm going to put the IV in. So I need to find the correct vein. I'm going to tie the tourniquet about 4 to 6 inches above the insertion site of where I think I'm going to go. So I'm going to palpate the vein. I find a site that I like. I'm going to use my IV start kit that I have already opened up, and I'm going to scrub this site and allow it to dry for 30 seconds. In that time, I'm going to release the tourniquet. I'm going to assemble my IV, make sure everything's open and ready. I'm going to put on my gloves. I'm going to re-tie the tourniquet. You want to make sure that you do not repalpate the site that you've cleaned. You're going to pull the skin taut and go in at about a 30-degree angle. You're going to look for a flash. And you're going to slowly advance the catheter in while pulling back. Make sure you release the tourniquet. When you put your Tegaderm on, make sure you've put on the date, time, initials, and gauge size. So that would go right on here. You don't want to put anything obscuring the insertion site. You want to flush to make sure the line is patent and that there is no sign of infiltration. Once you're done, you can tape this up to secure it even further, and you would document in your electronic medical record or paper charting system, and make sure you document patient education as well.